When teaching ultrasound, it's sometimes hard to tell why a learner is struggling by looking at the screen. Instead, you get a lot of insight by watching what they're doing with the probe, watching their hand. In this video, I'll demonstrate some common errors that learners make, and we'll see if you can identify them. What I did wrong there is I started my cardiac sweep too close to the xiphoid. You want to start low in the midline, bring your probe parallel to the abdomen, and slowly advance up into the epigastrium. That'll give you the best liver window and the best angle to look at the heart. You'll also notice if you look again that I swept too quickly. So on that scan, I was holding the probe improperly. To do a fast, generally you should place your fingers underneath the probe and hold close to the tip of the probe so you have fine control over the position of the probe as you do your sweep. On that scan, I swept much too quickly. It's really important that your sweep is slow and controlled. The sweep is the important part of the FAST exam. Everything else is just finding the right spot. Make sure you sweep slowly. On that scan, I started too anteriorly. I was looking back at Morrison's pouch. It's important to move the probe parallel to the floor as posteriorly as you can go and get the best view of the kidney there. That's the best point to do your scan. A common problem for beginners, especially when leaning over the body to scan the left upper quadrant, is subtly pointing the probe down towards the patient's feet, or caudal. In order to see under the diaphragm and get a good scan, the probe needs to be straight across or even angled slightly cephalad to allow you to see the diaphragm from 6 to 9 o'clock, which is in the middle of the patient's body. Not like this, but more like this. On that scan, I started too low, too caudad. You need to start the aorta scan right at the patient's xiphoid. I feel it with my finger, I nestle the probe up against it, and then I bring the probe up to perpendicular. Then I start my scan. Also, there was part of the scan where instead of keeping the probe completely perpendicular, I started to move it around, maybe to try and deal with some bowel gas or a less than optimal image. That actually doesn't usually work very well. You want to keep that probe completely perpendicular to the aorta. On that last OB scan, I was looking down at the uterus. You want to maximize your bladder window so that you can see as much as possible. You bring the probe down to nestle against the patient's symphysis pubis, and if anything, look up through the bladder slightly. Then you can do your sweep. In summary, when teaching ultrasound, it's really important to make sure you're watching the learner's hand. That's how you'll ensure they get great technique. Take care, and remember to check out our blog at emusottawa.blogspot.ca for lots of great ultrasound tips and cases.